Good morning. It's obviously been a very busy week for all of us in the state in response to our COVID-19 outbreak, and we don't expect that to change in the near future, unfortunately. With me today are Health Department Secretary John Weisman, who will speak, Insurance Commissioner Mike Kreidler, Labor and Industries Director Joel Sachs, and State Health Officer Kathy Lofi will be making some comments and stand for your questions. First, I'd like to say that all of our hearts are with people who are suffering and have suffered in the state. It is significant. The anxiety that family members have about those who are in care or have been affected is profound. We recognize that, and I know all Washingtonians have them in all of our hearts, and we're going to do everything we can for these families. I want to repeat my appreciation for the emergency first responders and the healthcare workers. These ground level people are working day and night. There is obviously some risk to them, and they are showing both professionalism and courage, and I appreciate both. Our priorities in state government in this regard remain the same. We are attempting to do everything humanly possible to slow the spread of this virus, and we are doing all we can to encourage all Washingtonians to be effective leaders in this effort, to exercise a calm and deliberate decision-making in their personal and professional lives. And I unfortunately can say that that is happening. I've been pleased to see that people are acting with a view to science rather than fear, and a view that we are all in this together rather than pure self-interest, and we all be appreciative of Washingtonians' response. I want to thank the legislature for acting quickly in a bipartisan way to approve $125 million in emergency funding that can help a variety of individuals and governments respond to this emergency. The legislation has an emergency clause, which means the Office of Financial Management can begin to take action with these funds just as soon as I sign the bill. These funds are for state, local, and tribal entities to help carry out the directives of my emergency declaration. We're also expecting an infusion of millions of federal funds from Congress. I want to thank all our congressional delegation, Representative Del Benny particularly, our two senators, and everyone who's pitched in this regard. I've had several conversations or texts with Senator Murray, and I can tell you that our delegation's really been pitching in. At my request, the Department of Labor and Industries is working to ensure compensation protections for healthcare workers and first responders who cannot work because they may have been quarantined or may have contracted the viruses themselves. We should have their backs. It's the right thing to do. So our protection will include coverage for medical testing, treatment expenses, and time loss payments for healthcare workers and first responders who cannot work if they are sick or quarantined because of the COVID-19 virus. Labor and Industries is also encouraging employers to continue to pay workers who are quarantined after being exposed. Today, in accordance with my emergency proclamation, our insurance commissioner is issuing an emergency order to Washington state health insurers requiring them to waive copays and deductibles for anyone requiring testing and treatment for COVID-19. The order applies until May 4th, and I'm just great to see our really effective insurance commissioner jump into this task, and he'll speak in a moment. We're also providing operational and workplace guidance to all of our state employees to encourage a healthy workplace. That includes strongly encouraging people to stay home if they feel sick, maximizing abilities to work remotely out of the office, and for areas where employees heavily rely on mass transit, adjusting mass transit options so the number of employees riding simultaneously is reduced. Some of our scheduling can help reduce the load on the public transportation system. We are also encouraging non-essential meetings of over 10 to be postponed or held virtually in any way that is possible. We have good news on the expansion of testing capacity that Secretary Weisman will talk about shortly. We've been involved intensely in this regard. I'm happy we're going to have some good news on that. Yesterday I met with emergency operations workers at Camp Murray in Tacoma and at the Department of Health in Tumwater. These people are doing tremendous work. I also visited a potential quarantine site on Department of Corrections property at the Maple Lane School, and I left feeling confident that this site can help us meet our needs to help people who have to be in isolation be safe and reasonably comfortable during that period of time. State officials are in touch with local officials in South Thurston County about that operation to answer any concerns there. I'm very confident that that is a safe facility. It is geographically remote, and I feel very confident about that siting. This virus is spread by close contact with infected individuals. Quarantine sites reduce this risk. And I was pleased to hear from the director of the CDC yesterday that he thinks Washington State has the best public health system in the nation, and we've been seeing it at work. The USA Today ran a story this week saying Washington was well prepared for an epidemic relative to our peers in the other 49 states. There are many Washingtonians working at the state and local levels who deserve our thanks for putting us in a position to be able to say that. As you know, Vice President Pence is visiting Washington today. I've already had several conversations with him in the last week, and we will be having more this evening. I am pleased that the federal government has responded to my request and requests of several other governors that we have more federal resources to address this outbreak, and it will only improve and expand our response going forward. I'm also pleased that the federal government has waived a rule that otherwise might prohibit testing of people with relatively mild diseases. Dr. Kofi will talk about that a little later this morning. For the uninsured in our state whose doctors believe they need testing, I am announcing that we have the authority and intention to cover those costs by the state of Washington. And we're talking about the costs of the test only. We'll continue to expand health care insurance as we are so committed to in the state of Washington. I'm aware that there is uncertainty among the public about whether to get tested for the virus. Testing kits are limited still, so health professionals have established a criteria themselves about who is eligible for testing, and the doctor will talk about that. We need to be clear on this matter. If you think you're experiencing mild symptoms, a positive or negative test result does not change the advice we have for you. Stay home, rest, take care of yourself, avoid contact with others, and follow your physician's or medical provider's advice. Health providers' priority is testing people exhibiting symptoms who are seniors or people with underlying health conditions. Based on input we've heard from numerous medical experts, the vast majority of people who contract the virus will experience only mild symptoms or none at all. So the best advice I can give to people about whether or not to have the test is to talk to your medical professional. They will give you good advice, but in many, many cases, even mild symptoms will not require the test. Now, we know we've had significant outbreaks in King and now Snohomish County. And we know we have to make decisions about how we act to reduce the potential of increased transmission of the disease. And so we believe people need to give serious consideration of congregations of folks that really are not essential to our personal lives and our well-being of our families. So I have encouragement. And my encouragement is that, number one, people with compromised immune system, people with respiratory underlying conditions, people with underlying health disabilities, or are of advanced age, really should not go to areas of congregation and confined settings with other people, given the risk factors that they have at this time. For people who are not in that category, who may not even be concerned about their own health, we think people should give serious consideration about whether they go to non-essential congregations of people that are not necessary for their well-being or their family's health or economic well-being. And the reason for that is that even if you are perfectly healthy, And even if you wouldn't mind having a mild symptoms, you still potentially could transmit the disease because you don't know you may have it. So that's something we want people to consider. Now, this is not an order, but it is encouragement for people to think about our responsibilities to the community. People may think that advice is premature, but with the potential of transmission and what we have seen in other communities such as Wuhan, China, we think it is the appropriate encouragement to people. If we find ourselves in the position of having to cancel events by law, and the governor has the authority under the executive emergency order to do so, we'll make our best decision based on the best medical information we have, on the best genetics information we have, and the best epidemiological information we have. And fortunately, we are very lucky to have some of the best medical researchers in the world today right here in the state of Washington. But we would start this with a dialogue with the community, and that's what we're doing in the last few days. I'm skipping forward a little bit because others will talk about some of these issues. I just will note this too, that this is a period of substantial anxiety in our state. It's real, it's significant, and we need to recognize it. And I just want to say I've been very proud of our state that so far people have kept their wits about them. They have listened to medical expertise. They have largely acted with the community in mind and their families in mind. And I'm just happy that people are going to continue that attitude so we can do the best we can right now.